I'm not a tech expert, can you tell?
I think it's not what.
Fantastic. Thank you very much for such a warm welcome. So I stand before you, and someone said to me, oh, did you talk last year? And it was so funny because there's absolutely no way that I would have talked last year. Last year I was a newbie into social media, and there's no way that I would have ever been standing up before you talking about what I've done in social media. So there you go. I work in palliative care at Peter MacCallum, which is funny because I'm often in the position of being a little bit the dumb doctor in the room, or is perceived by others, and that's the way I feel today too, with all these experts talking about branding and, you know, the way of conceptualising our place in social media. And the approach, I guess, that I took was somewhat less clever than that, I think, and it's been a little bit more accidental. But that's the beauty of social media. You always learn amazing things that you never expected to learn. So I just wanted to take you today through a couple of the things that we've been doing with social media.
Sorry, Sonia, can I just interrupt and say we're broadcasting this on Periscope, and we've got Dr. Christian Sinclair from Kansas City following along and commenting at the moment.
Christian is amazing.
He says you're not a dumb doctor, by the way.
Oh, thank you, darling. He's very kind. Christian is amazing.
He says, hey, everyone.
in palliative care in the world, so that's really fantastic. So why Palaverse? And although from the introduction it sounded like I set it up, I absolutely didn't. It was just a group of people coming together on social media. We're very honoured to have Alyssa here today from Western Australia, who's a fabulous hard worker in Palaverse. We wanted to create some connections between people who are really interested and passionate about palliative care, not just doctors, not just healthcare workers, but everyone, because we believe that palliative care is a really important part of our health system and that we need to promote it in order to make the quality of care better for people. So we know that there's so much technology around, but if you go to the bank, you can jump online and do internet banking, but in health, we're so far behind. I tried to broadcast a lecture at work recently, and I was told I wasn't allowed to. It just wasn't permitted. It wasn't in a policy. In any other setting, you'd be jumping on YouTube and popping it up. So I think we really have got a long way to go. But that's what makes it so exciting. We're always learning new things and being able to apply technology in different ways. There's a growing interface, as we've heard from Jen, between social media and healthcare. In the olden days, the doctors would tell the patients what to do, the patients would say, yes, sir, but now it's an interactive dialogue between healthcare providers and patients, and we want to be in that space. Australia and New Zealand, of course, are really important for us, but a lot of this stuff is coming out of America, and we've been quite a long way behind. What was I going to do about next? This is us. We've got, Alyssa's got a Palaverse t-shirt on. She can't show you because she's managing the camera there. And there's a group of people that got together from all over Australia and wanted to start doing some things in the social media space. We wanted to get people talking about palliative care. We wanted to not just duplicate what was already out there in terms of palliative care resources, but also to create something new. And we really wanted to find out from our people what they wanted out of a social media organisation that talked about palliative care. If you're in the country or in Africa and you don't have other people who do palliative care, we wanted to provide that group that was able to provide education and support to people. We're from all over Australia. We're a little bit doctor heavy, but we have got some nurses involved with us, which is really fantastic. And we're in various locations throughout Australia, as you can see, and New Zealand as well. So it's got an Australian-New Zealand focus, but we've also got others who are involved too. We conducted a survey to find out what people wanted, and really interestingly for me, the main thing that people wanted to know was what research were people doing in palliative care in similar areas to them. How could they find out about it? Who could they connect with? Because often people don't have many people in their neighbourhood who are doing the same sort of stuff as them. People wanted to have online forums, and they also wanted to have content in clinical articles. Cool. So what's happened since we started? Heaps has happened, but if you'd asked us a year or two ago what we thought would happen, it actually looks quite different. So here is a poster of Chi and James presenting in Taiwan at the Asia Pacific Hospice Forum about the researchers database that we've set up. We've got a really happening Twitter presence, I think, and many of you in this room will have seen Alyssa tweeting for Palaverse today. We've also launched into Facebook, and we run a blog, which many of us contribute to. We've been doing some good work with live tweeting at various conferences, and what's happened recently, I think, is that we've been doing more and more talking about social media in healthcare, not just about in palliative care. Alyssa does great work doing weekend reads for us, which is fantastic. Cool. This is one of the things that we weren't expecting to happen. So one of our team members works in New Zealand, and there was a patient there who was extremely ill and needed to go back to Samoa to die. And he needed a medical person to escort him because he was so sick. We didn't have any money, of course. We all just chucked in $50 to buy the t-shirts, but we actually are not a company or anything like that. So James set up a thing, a crowdfunding thing, and actually raised several $1,000s to enable to buy the plane to take this guy back to Samoa, and then he live tweeted it as well. So it was very cool, and he was able to take the patient back to Samoa. The patient was able to die in his home with his family there, which was fantastic, and we raised the money through crowdfunding, so that was very exciting. We've been doing quite a few talks about social media and education in various fora, which has been fun. I said before that social media is about learning new things. I've learned how to do webinars. Today I've learned about Periscope. Every single day I learned something amazing that I've never heard of before, so it's very exciting. We did a webinar and we live tweeted it a couple of months ago, so that was very cool as well, and now I'm going to be able to use that technology in education for palliative care doctors. And I'll talk a little bit later about the thickened liquid challenge. Is Mukesh looking nervous, do you think? All right, so far we've had 5,000 visitors to our site from 2,000 different people. Our main site is probably the blog, and then Alyssa's cleverly lined things up so that Twitter and Facebook pages feed off that. They're from all over the world, and one really important point that I wanted to make was that people in low and middle income countries don't have the same resources as we do, and there are many palliative care worldwide forums that we participate in, and people from low and middle income countries are passionately interested in this area and may not have access to journals and resources as we do, so that's why social media can be really incredibly important for them. We've got about 700 followers on Twitter, which is a bit cool. One of the other things I've learned is about how to do good presentations, well, passable presentations anyway, so I'm a bit excited with my animation here. So what are we going to do next? We actually don't know, but what we think we're going to do next is that we're going to move more into the education space. So often in healthcare we give lectures to 20 people and it's lost. And so we think that we could have a role in providing platforms to promote educational activities all over the world. We definitely want to have more consumer participation, and as you can imagine, this is a somewhat difficult space in palliative care, as many of our patients are older and many of our patients are unwell, but that doesn't mean that we're not going to try. We want to be a part of the bridge, as Jen's been talking about, between consumers and healthcare providers, and we also plan to do more of the social media stuff because it's just fun and cool. So we're hoping, we talked a little bit about FOMED before, and for those who are new to social media, FOMED is free and open access medical education, and we think we might do FOPAL. I'm not sure about FOMPAL or FOPAL, but free open access palliative care education, and get some fora happening where people can be involved with palliative care education, not just health professionals but consumers as well. We pride ourselves on being very inclusive and friendly, so I hope that that will continue to be the case, and we want to foster links throughout our community. So that's all I wanted to say about Palaverse, but I've got two more small things that I wanted to talk to you about. And the first one is Hello, My Name Is, which is a passion of mine. So you can see my little white badge here. And has anyone heard of Hello, My Name Is? Fantastic, that's great. So Hello, My Name Is a campaign that was started in the UK by a doctor called Kate Granger. And she is a geriatrician, but she was unfortunately diagnosed with sarcoma. So she spent a lot of time in hospital being crook as a dog and having things done to her. And one time she was in hospital getting increasingly irritated because people would come and poke needles into her or give her care, and she didn't know who they were, and she was feeling very unwell, and she had to keep saying, "I'm sorry, what was your name?" And that was upsetting her. So she wrote an article in the British Medical Journal. So this is just a bog standard geriatrician, no one special. She wrote an article in the BMJ, and it became this worldwide social phenomenon designed to help improve patient-centred care by getting doctors to introduce themselves to patients. So if the technology lines up, Yeah.
Just going to show lead spins for 2 seconds. The screen's having a bit of trouble with the video. Google.
If it's too hard, we don't have to.
No, we have to hear it.
It's kind of nice to hear her own words, because I talked to Kate on Twitter, but I didn't realise she had such a strong Yorkshire accent. So, because in my head she's got an Australian accent, of course. So.
Hello, My Name Is campaign was designed to encourage, inspire and remind healthcare staff about the Hello, My Name Is campaign was designed to encourage, inspire and remind healthcare staff about the importance of introductions. It's set up to get people to introduce themselves to every single patient that they meet. In Mid Yorkshire we've been leading the way, but as a member of staff in Mid Yorkshire I'd like this to be a call to action, to make sure that every single time you meet a new patient or a relative or a visitor to our hospitals that you pledge to introduce yourself to them. Practically, one of the things we're doing with the campaign is asking people to send themselves holding a hashtag Hello My Name Is sign with their name written on it, and those photos are going to become a huge photo wall representing our workforce.
So that's Kate. She's very inspirational. She's made this enormous change thing happen in the whole of the NHS. And I came to work at Peter Mac, and it's a very complicated medical environment with lots of different teams involved. And I met a lady who was about to go home to the country. She was very sick. She only had a few weeks to live. And she just had to see the dietitian before she went. She was waiting to see the dietitian, very keen to get out of hospital. She'd had a terrible time. And I came in to see her one day. I was kind of expecting her to have already gone. And I said, oh, have you seen the dietitian yet? And she just burst into tears and started crying. I said, what's the matter? You know, was she horrible to you? What happened? She said, no. I only had to see the dietitian before I went. This very nice young girl came in and talked to me about all sorts of things. I talked to her. I didn't know who she was. She went away. Turned out she was the dietitian, but she's gone home for the day. And now I can't see her today. I have to wait until tomorrow. So the fact that she just didn't know who this lady was cost her 1 extra day in hospital. And as it turned out, she only had 2 weeks to live. And I just thought, this is so stupid and we must be able to do this better. So I started to promote these white badges, which are very clear and easy for patients to read, which was a good idea because it really was a problem in our hospital and in Australia as well as in the NHS. So the cool thing was that this was my Pledge for Change Day for last year. And then because I'd actually got some engagement with my hospital and got them on board, I did a video for Change Day this year showing that what people pledge really can make a difference. And out of that I got some media, thanks to Julia Medju.
Who's meant to be here today.
Who was meant to be here today. And out of that I got a whole lot of publicity, not just for that pledge but also for my new pledge, which was about Letter to Me, which I'll talk about a little bit more in a sec. So the idea came from social media, made a pledge in Change Day, we did a survey and also told the story of why this was important, and I think telling narrative as part of social media is something that I've really learned. And then my CEO made a pledge on behalf of the organisation, which was terrific. We did a survey and found out that 90% of patients really do care about what the name of their doctor or nurse is. Doesn't matter so much if it's the receptionist or not. But only 2/3 of our inpatients actually could name the nurse that was looking after them on that shift. And only 1/2 of patients could identify all the doctors involved in their care. We didn't actually ask them what the name of the doctor was, we just said, do you know the name of your registrar? Do you know the name of your resident? Do you know the name of your consultant? So it seems as though we do actually introduce ourselves once, but then people forget because they're in a very complicated environment. There's no reason for that Yoda slide. It's a totally gratuitous slide. And so when I got the media, the thing that the media was interested in was actually letter to me. And that's an astoundingly brilliant idea that I also got from social media. Why do I, as a hospital doctor, write a letter to the referring doctors? Why don't I write it to the patient and put the patient at the centre of the care team, which is exactly where they should be? So it's actually a little bit harder than I thought to totally reframe the consultation in terms of what's important to the patient, why they came to see me, and to put everything down in paper in people language rather than in medicalese. But it's been very fun and the patients really, really like it. So the reason that it's a good idea to leave writing your talk to the last minute is that yesterday I heard on the grapevine that my Chief Executive Officer had taken my other idea that I've been pitching for ages, which is discharge summary to me, which is weird that we should write discharge summaries to the patients as well, to let them know what happened in hospital, what their test results were, what the diagnosis was, etc. Because we write these complicated discharge letters to the GP and the patient doesn't see them. And yesterday, because I'd had these other successes with Hello, My Name Is, etc., the CEO pushed through all of the resistance and just went, we are doing it, just do it, which is so fantastic. And I think that's just an example of how that if you're able to have some small success in one area, it puts you in a much better position to be able to deliver change in all sorts of other areas. And that's not just because you have a little bit of a track record, but also because you know all of these amazing people, some of whom are in this room and some of whom are following online, that can mentor you and help you to develop ideas into reality. So what we need to do is really use the people, use the masses, and also as health professionals, we really need to use the medical literature to demonstrate the validity of ideas, and there's heaps of stuff out there. So for the finale of my talk, I wanted to, who knows about the Ice Bucket Challenge from motor neurone disease? Yeah, fantastic. So there's a similar theme in palliative care and geriatric circles at the moment about thickened liquids. And for those of you who might not be aware, when elderly patients who are debilitated have problems with swallowing, often we ask them to drink, or we tell them, to drink thickened fluids, which is kind of goopy. Are you stirring there, Alyssa?
No, it's over there.
Oh, it's over there, excellent. As part of an awareness campaign that was started by GeriPal, we've been filming people drinking thickened liquids in different parts of the world and then nominating someone else to drink thickened liquids. So the point is that the evidence for the use of thickened liquids is not actually that strong. And there, of course there is some evidence, but it's not a convincing case that drinking thickened liquids when you have problems with swallowing will stop you from dying of pneumonia or will extend your life. But we certainly know that it impairs your quality of life and it stops you drinking as much so you can get dehydrated. So Dr. Mukesh has kindly been volunteered to be filmed drinking some thickened liquids. We're going to put it up online, and then he will nominate the next victim to drink some thickened liquid. So Mukesh, we've got our media people here. Coat off, definitely. So this is social media advocacy in action. Cheers.
It's even pour out the glass.
We did make it a bit thick for you.
Level 900.
Level 900 thickened fluid. Is that delicious?
Disgusting.
Disgusting. Would you want to drink up and enjoy your nice cup of tea in the afternoon if it tasted like that?
Absolutely not.
Absolutely not.
Life's not worth living.
Life is not worth living. And who would you like to nominate to do this
Well, I
challenge
think
next?
this is from Peter McCallum Cancer Centre
Yes.
in Victoria.
Yes?
I challenge our Victorian State Health Minister, Honourable Jill Henderson, my local member of Altona, to take the next one.
Fantastic.
Thank you.
That's lovely. Oh, I've lost my flicker. What did I do with it? Excellent. Lovely. And that's just about me. So social media for change in union. Change begets change. It gets easier with time as you build relationships and networks so that you can affect change. you often learn something really different to what you think you're going to learn. And it's great to collaborate with like minds and mentors, because when you get knocked back, which happens all the time, it's terrific having a group of people that can help you be more resilient, keep going. And lastly, sometimes it's a good idea not to write your talk till the last minute.